Greetings, Al Branca here, Vice President of Sales and Marketing. And with me today is Ann Wolf, Director of Business Development. Hi, Ann.
Hi.
Appreciate you joining us today.
Thanks for having me.
And although you wouldn't know it to look at her, Ann brings to our organization several years of experience in sales, both individual and corporate. And Ann, before we get started, I would like you to spend a little time and give us a quick snapshot of your business experience within the benefit industry.
Sure. I have about 28 years in sales and marketing. The last 17 years have been specifically as a health and life broker. And the last 10 years, I've owned my own benefits and consulting company.
Well, that's great, Ann, but give us an idea of the type of clients you've worked with in the past.
I've worked from everything from individuals on a one-on-one basis to organizations of smaller sizes, 10 to 100 employees, and very large organizations that have thousands of employees, from corporate to nonprofit, and any type of individual that is looking to have health benefits, life insurance, voluntary benefits, etc.
That's quite a portfolio. As you well know, Ann, we already have the nation's premier pharmacy discount card, and now GBR, Get Benefit Relief, our suite of dental and medical discount programs. However, there are a lot of competitors in this space, so what, in your opinion, separates GBR, Get Benefit Relief, from the rest?
I think if I had to point out the biggest difference between GBR and some of the other products on the market, it would be the niche we find. We fill in gaps in insurance, as well as the high deductibles that are being created, some of them as part of the Affordable Care Act. When you're insured, there's lots of places where we can't find products that help in those areas, as well as when you're uninsured and people are looking for dental, vision, just even a doctor and can't afford one. And GBR really fits that mold.
Well, we've got 4 plans. We've got the dental, vision, select, and plus. All have their niches and the services that go along with that. Which, in your opinion, is the best value?
I think by far it's the plus plan. For all of those people walking around, and even if they aren't insured, they still need access to dental and vision. Most of the new plans do have a pediatric type benefit. Doesn't cover all pediatric, but most people think it does. And it doesn't cover adults at all. So people who are looking for access to dentists, it is the largest network in the country. It's the Aetna Dental Network. Again, it's not insurance, it's a discount plan, but it's a tremendous plan. We're giving them discounts to vision. And included in that plan is a telemedicine product called TeleDoc.
Yeah, tell us a little bit about that.
Sure. The TeleDoc is a program that gives access to every member 24/7 to a doctor. You literally call up. Within 20 minutes, you'll get a phone call back. And you can get a physician to answer questions. You can Skype, you can JPEG, all of that access instantaneously. With the new high deductible plans, every time you go to a doctor and it's not a well visit, you're going to have to pay towards your deductible because only well visits are at no cost. If you're uninsured and have no access to a doctor, this is tremendous. Your entire family has access to a doctor 24/7. I'm a mom of 2 kids, and I know for me there's lots of things that happen late at night that I'd like access to a doctor to ask questions. I don't know whether I should be running to the ER, whether I need an antibiotic, whether or not it's just a matter of, yeah, you need a cream for that. And I could save a lot of money not going. Not to mention if I was talking to an employer about this, it means my employees wouldn't have to call out sick because they'd have access to a doctor without saying I need to go, drive each way, and then sit in the doctor's office in the waiting room for a large period of time.
The fact that you mentioned cost and bills leads me to another question. Also included in our Plus program is Medical Bill Saver. Tell us a little bit about that.
So in the Plus plan is also Health Advocate. And under Health Advocate, which is a tremendous company out there, there's 3 different products, and one of them is the Medical Bill Saver. And Medical Bill Saver means that anyone who has a bill over $400, they will go to work for you trying to negotiate that bill down. Maybe you went out of network, maybe you're just uninsured, or maybe you just have a bill and you can't pay it, your deductible is just too high. They'll call up, they'll negotiate the plan, and everything they save you is yours to keep. So if the bill was $3,000 and they get it down to $1,000, you pay the provider the $1,000, and you've now saved $2,000 that you wouldn't have had simply by making a phone call to Health Advocate.
So Ann, if you were an agent out on the street today, where would you spend your time and who would you target to present these discount plans to?
I think I would start wherever I was most comfortable. wherever the warm bodies are that you feel the most comfortable talking to.
The sphere of influence.
Correct. If you are more comfortable speaking with individuals, your friends, your peers that you meet on a day-to-day basis, maybe it's your kid's basketball team, whatever that is, I would start there, because at least you'll get comfortable talking about the product. The product really will sell itself. It's one really low fee, and it covers the entire family. So whether they choose the dental alone plan, the vision alone plan, they choose the plus plan, which has all the products in it, it's really, you can make that conversation in less than 5 minutes. And it's a good practice. If you are a broker out there that's been dealing with organizations, maybe it's your church, maybe it's a nonprofit group that you're involved in, that's a great place to go, because remember, this product can be sold as a individually purchased product, or it could be sold on a group type platform, meaning employer paid. Oftentimes an employer would want to pay for it because, one, with these new high deductible plans that we've talked about, sometimes employers haven't had one in place, and this is the first time they're going to put them in place. So they could say, listen, we're putting a deductible in place, but we're also paying for you to have access to dental, vision, and a doctor 24/7. So you won't always have to use your deductible. So that's a great way to get it to be employer paid. They're going to keep those employees in their seats. On the flip side, when you're talking to a nonprofit, their community are people they want to help. It's a wellness benefit. Certainly the organization isn't going to pay for it, but to say, hey, listen, here's a great wellness benefit. We're already giving you the RxCut prescription card. Now we offer these other benefits. Yes, they're going to cost you a little bit of money, but they're going to cover your entire family, and we're going to help take care of you. It's a wellness benefit. So each one is a different way to start, depending on where you're comfortable, and then move up into, certainly everyone's going to make a little bit more money when they start selling to groups, because you've got a lot of people at one time. But start where you're comfortable, because it's a one-person sale easily.
And I'm sure everyone knows business owners, so they can eventually, when they feel comfortable with the product, move up market a little bit.
Right, and it's important to know there's no minimum. So whether the company has 3 employees, 2 employees, or it has 200 employees, or even 20,000, have as many as want to sign up. If it's a voluntary benefit, meaning they let us go in, you can go in as the agent and sign up 100 of them, 10,000 of them. They can each be signed up. We have tremendous access to how they can sign up between applications and online ways to do it. So we really run the gamut in making it as easy as possible for the employer.
Well, Ann, thank you for joining us. We certainly appreciate your time and your knowledge.
Sure. Glad to be here.
GBR, comprehensive, timely, and extremely affordable.